So I had a patient today, and he's 33.
Okay.
So I've been having patients in their young ages. You see people 28, 29 coming out with CKD. CKD is chronic kidney disease or end-stage renal disease. So it's not more a disease of old people. Right? You expect maybe 70, 80. No, now we're seeing it in the younger generation. And then most of the things that people do nowadays predispose them to actually having kidney diseases. So most of the drugs that they sell around. Some of these things that they will say is for high libido, is for make you have sex more, especially in males. Or they will say it's to help you wash your blood. I know there's this particular one that's going around. I think they call it ginger herbs. They say it's to flush your blood, flush everything. Have you heard of it?
Before uncle.
You know, funny thing, yeah, funny thing. The patient that came today showed my consultant, nephrologist, and I was just telling her about it before the patient showed us the picture, and I was like, "This is what I'm talking about." So it's trust me, in the future, nephrology is going to be a very lucrative, quote and unquote, specialty because things that people are doing these days, their body, from cosmetology to they say they call it general health care. So they are drinking anything. It quote and unquote to wash their blood, to wash their system, not knowing that they are putting a strain on their kidneys, and the kidney can do so much, just so much. You understand? So it's important for people to actually pay attention, pay attention to their kidney health. And nowadays, we're seeing more young people come down with hypertension. I have a friend who recently he got diagnosed with hypertension. So people like that, when you get diagnosed with things like that early enough, the chances for you to have chronic kidney disease in the long run is very high.
Yeah.
So those are the ones that you now see coming down with things like chronic glomerulonephritis. And before you know, they are presenting here, and you are just sad that you wish they could maybe speak to a doctor earlier who could place them on antihypertensives and monitor them. You understand? So the health seeking behavior here in Nigeria generally is poor. We all know that. And then the system itself is not even helping matters. So you
Now,
get.
sorry for
Yeah.
cutting you. But for someone who's listening to you, the person doesn't know who you are, what you do right now, and what you have seen. I just want you to tell them who you are so that they know that this person speaking is not just speaking from his head. This guy knows exactly what he's talking about.
Oh, okay. So Dr. Shea. Dr. Shea. When Dr. Frederick met me, I was still a medical student. So I've known for a while now. But right now, I'm a certified medical doctor. I deal mainly in kidney health, So I work mainly with patients that have come down with kidney failure, so to say, patients that are on dialysis, patients that are being prepared for transplant. So that's why I know a lot of stuff about the kidneys, because of most of these people have already gone through, they've done these deeds already and it's already too late for them. You understand? So those are the people I work with. I work with the people that already have their kidneys are already gone, basically. But also I still see some patients that maybe their kidneys are still salvageable. So when we're talking about kidney health, we can speak about acute kidney injury. So those are the ones that recently something happened that caused them to need dialysis, so to say. And then there are those that whatever injury they've gotten to their kidneys has been happening for a very long period of time and they did not know. And the thing about the kidney is that you would not know that your kidney is spoiling. You will just be going around, nothing is happening until one day you just say that you are feeling weak, or you are vomiting, or you are having hiccups, or your leg is swelling, or your urine is just foamy. You are seeing foam inside your urine. You don't know what's going on. Then you come to doctor. Doctor will say go and do some tests, and before you know it, you say you have kidney problem. Then you'll be asking yourself, what did I do wrong? What happened? Not knowing that these things have been building up, over time.
Yeah.
So those are the kind of patients I actually deal with for now. And it's to be honest, it's a very, very sad thing, especially when you see people that could have, because some of the causes of these kidney problems are preventable. For example, what you were talking about before I joined was hypertension.
Yeah.
I know you're talking about blood pressure when I joined inside.
Yeah.
You realize that some people don't even know they have hypertension. They don't know. So by the time you come and then you ask them how long have you had hypertension, they'll say, it's when they checked my blood pressure last week that I saw. Meanwhile, this person has had it for a long time, but because you don't check, you don't know, so it's been there for a very long time, and then by the time you are presenting, it's too late. So same thing with diabetes, and herbal concoctions, all this agbo, Everybody you wake up early in the morning and you say you want to go and drink a good jetty, and all these things. And also drugs. Some people abuse a lot of medications, things like NSAIDs. NSAIDs are all these alabukun, all these painkillers. You say your back is paining, you will not go to your doctor. You just go and pack painkillers and put it in your stomach. Things like that. So things like that actually have effects. Then we've realized now that even some tattoos, people that go to tattoo parlors, they realize that the inks that they put on their skin actually affects the kidneys. You understand? So I'm not coming to say don't go and draw tattoo. I'm not saying that, but I'm saying that you realize that some of these tattoo parlors are using toxic substances on people's bodies, and then in the long run you realize they are causing problems. Then things like marijuana, weed, stuff like that. Also, I have a patient that we're managing now. His own was caused by chronic use of weed. He'd been using weed for a very, very, very long time, and now because of imagine someone that is on dialysis that we're still trying to counsel on stopping the thing that causes kidney problems. You understand? So these things are very real things in our society. Just for people to hopefully, reach out to someone early enough, go to the hospital when they see symptoms. Don't try to self-medicate. Don't go to babalawos. Don't go to traditional healers. Trust your doctors more. And
Now,
before taking drugs that you see on Google, go and meet your doctor. Because it might just be spoiling your kidney. You don't know. You'll be sitting there in front of me in my office. It's a very, very bad thing.
there are some things you mentioned there, and whenever we talk about these things, we always get backlash. You mentioned them. I just want you again to talk about them. You mentioned agbo, you mentioned weed, you mentioned painkillers, you mentioned abuse of medications. And most times people will say, doctors, you people you care about money, but they don't know that most part of our job is to even ensure you don't come to see the doctor. Because when you're coming to see the doctor, you are spending money. So I want you to just please again emphasize on agbo, because right now you're seeing people with end-stage kidney disease, herbal concussions, and the whole stuff they sell on the internet to wash your blood, cleanse your blood, and they tell you that our forefathers were taking these things. Now they are taking them and coming down with kidney problem, kidney failure, end-stage kidney disease. So again, I beg, just help me talk about it. I talk about it, but sometimes I get tired.
So the problem is this. The problem with most of these herbal concoctions is this. They are using different chemical compounds. Do you understand? Different chemical substances, that's in different proportions. So the problem is that our kidneys can only filter so much. Do you understand? So the difference between herbs and the drugs we use is that the drugs that we use, that we prescribe, they have broken down these drugs in a way that is safe for our body, or broken down these chemical compounds in a way that is safe for our body to actually excrete and eliminate. You understand? And then it's still, okay, I think I'm doing some a comment. How about actually one has seen doctor concern and the problem is not resolved? Like you say, okay, we'll talk about it. And it's so these chemical compounds are broken down in our normal medications, the way that it's being eliminated perfectly from the kidneys. But when you see these people that just combine different things together, fine, those chemical compounds are there, but it can be in doses that are harmful to our organs. Do you understand? And that is the problem that we have with them. Because those things you are taking and you are drinking a lot of it, you're making your kidney work over time to try to excrete and remove all these things from your body. And your kidneys are, how will I say it now? It's like your kidney is like a filter system, and it can only do so much. I know I've been saying this thing that your kidneys can only do so much. You get to a point that you overload your kidneys, and then it will start telling you, Baba, relax, I'm having problems. This thing you're giving me is too much. You understand? And once that starts happening, it's just a matter of time, and it happens gradually. Thank you very much, Dr. Medu. It happens gradually, over a long period. So I'm not telling you that if you drink agbo today, your kidney will spoil today. That's not what I'm saying. But when it happens over a period of time, you keep doing it, and it's an habit. When the thing finish spoiling, you would not know because it's been spoiling gradually, 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 gradually. And all of a sudden, one symptom that you might know, it might even be in your 60s or your 70s. And one of the symptoms that you're noticing, maybe you just see that you're vomiting, or your body is weak, or something happened, your body just changed, and then you come to the hospital, and then you realize that the kidneys are no more functioning. No. Do you understand? Even you realize that even patients. So I feel this is also a cultural thing or a cultural shift that we have to make as doctors, because even patients that already have these kidney problems on dialysis, you see my patient come to meet me, and then I'm like, "What's wrong with you?" You realize that. Sorry, I'm going to use a medical word now. The patient that is dialyzing frequently is still uremic. So you're wondering what's going on, and then you ask, "What are you taking at all?" You say, my grandma gave me this leaf. He said to wash my system and wash my kidney. And you're like, it is usually very funny because this same thing is what got you here.
Yeah.
And then you are still using it. Do you understand? This particular same thing got you here, but you are still drinking. You are still saying, no, that's what I use, that's what I use, And then you realize that they are still very uremic, their urea creatinine levels are still very high, the renal function is terrible. You understand? So it's more of a cultural shift, and I like what you're doing, Dr. Frederick. You are always creating awareness. You cannot stop. It's just something as doctors, you just have to keep doing over and over and over again. And they say, "You as yes, let him hear." I know that even as much as we are out here doing social media, even family members, you see aunties that you talk to, they will say, "You cannot talk to me. When did you become a doctor?" when did you become a doctor? And then you are just watching these things happen. And then when push comes to shove, they're in your DMs or they're coming to the hospital, and these things are expensive.
Yes.
No, maybe one of you now make a video on the financial complications
Let me ask you. I want to ask you.
Crazy.
I want to ask you now. Thank God you went there. Dialysis. When we mention dialysis, people think it's like you just travel abroad. Please help us understand using the Nigerian perspective.
Okay.
How much is a session of dialysis? Number one.